Teladoc actually went IPO in July of 2015. So I think this is a really, really good time to get them on stage to talk about what's going on. I found what I considered a wow stat, and that was Teladoc, who's leader in telehealth, recently announced a company record was set during the month of November with a total of 101,600 telehealth patient visits. That's a wow. So anyway, I'd like to welcome them to the stage and introduce our moderator, Lisa Sunin. She's the Managing Director of GE Ventures. And with GE Ventures, she's focusing on early to late stage healthcare investments across health IT, health services, and medical devices. She writes a killer blog called Venture Valkyrie. And you guys should definitely check it out. It's on healthcare and investing, and hosts the popular podcast Tectonics. That's a mouthful. Thank you. Welcome them.
Hey, everybody. So, Jason, 101,000 visitors, were they all family members of yours?
Absolutely. I've got a huge, huge family, and they're all very, very supportive.
Yeah, so, excellent, excellent. Good to see you. Nice to see you.
Thank you, you too.
Our
Thanks
goal
for
here
everybody
today
for coming.
Is to shed some more light on Teladoc. It's one of the few digital health IPO success stories that we've seen in the last few years, actually. There have been a lot of digital health attempted IPOs and a lot of regret. Our other objective here is to do a better job than Sean and Casper, because you never want to make those guys look better than you.
They set a high bar, though.
They did, I know. They're smiley, those two. So why don't you give us, Jason, a quick overview of where you are today at Teladoc? What's going on there? How big are you?
Sure.
What can you tell us in the cone of silence?
Yes, exactly. As a public company, I have to adjust to not being able to say everything I'd like to say. Otherwise, the lawyers yell at me. So we're over 17 million members strong now. We've said publicly, north of 930,000 visits over the course of 2016.
Wow.
That's a pretty far cry from when I started, and we were doing, we did 101,000 in November. We did about 700 visits the month I started 7.5 years ago. So that's a pretty big ramp. We're about 725 employees, also crazy growth, and some growing pains that go along with it. We've grown our employee base about 350% over the last 2 years. And we'll do revenues now over 120 million in 2016, and we haven't yet talked about what we'll do in 17, but our most recent quarter was 60% plus year-over-year growth.
That's awesome. That's really great.
Thanks.
So the telemedicine space, I mean, back a few years ago was, it was like the flattest thing on earth forever, and then it took off largely because of regulation change, right, and the ability to do some of these things. Is that the single most important inflection point for you? Was that the change in reimbursement and regulation around?
I don't know. I think I like to say telehealth's been around for 140 years, right? 1876, Alexander Graham Bell invents the telephone, and people are able to interact with their doctors remotely. And then there were tons and tons. I remember early 90s, I built a nurse advice line. I was looking at devices built by Intel to put boxes in consumers' homes, and they were going to be able to do everything from their homes. There were tons of technologies. I say this at the risk of offending all the hosts here at CES, but there have been a lot of technologies focused on telehealth, and as you said, none of them really fulfilled the promise of telehealth. And
I had a few sad investment stories myself.
There's a lot of roadkill, right? I mean, there's an awful lot of telehealth roadkill. But I think what people missed were that there were, I would say, 3 big things that have to go together, all, as Sean said, in a symphony in order to make it work. You have to deliver incredibly high quality care that's sort of irreproachable. You have to build the technology, operations, and infrastructure to deliver that care at scale, and you have to change consumer behavior. And the third one's probably the hardest. So we put all 3 of those together in order to, I think, create an inflection
Do you think
point.
you also needed to have mobile phones?
Absolutely. So macro trends were super important, right? The supply and demand curve for especially primary care going in opposite directions and creating this big access gap. You know, if you looked at Paulina's slide at the beginning of the day, her number one moonshot was access to care.
Right.
So that's critical. And then all the technology, broadband, mobile, the proliferation of video, and the regulatory environment certainly. You know, we've spent a huge amount of time with medical boards and in legislators' offices explaining to them why this is critical.
So to your point, not exactly an original idea. Alexander Graham Bell had it first. What makes Teladoc successful, though? Because you guys, in what appears to be more and more of a commodified business, and I know yours is not a commodity, there's all sorts of special sauce, that's where we're going. But there's a lot of companies that, if you didn't know a lot, sound a lot alike, right?
Yeah.
And a lot of them started right around the same time. A lot of them do, purportedly the same thing. Why is this not a commodity in your case? Why are you doing? What is it you're doing that's different?
Yeah. So it's a common misperception, really, that telehealth, anybody can do it, low barriers to entry. It's just an app and some doctors, right? And there's nothing further from the truth. There's no question any doctor can do telehealth on their own in very limited scale, probably not with any real quality assurance. But for us, it's about the quality of care we deliver at scale, and most importantly, that consumer engagement. So,
So what does that mean? What does that mean really? Because that's a lot of buzzwords, right? I mean, really? So what is it about the doctors that's better?
Yeah, so it's really about our system. We have almost 150 proprietary guidelines that are specific to the remote delivery of care. So we've had a panel of doctors go to the literature, find all the evidence-based guidelines, and adapt them to an environment where the patient and the physician are not in the same place.
Can you give an example of something specific?
Yeah, sure. So strep throat, right? Perfect example. I've got two little kids. I've got a 11-year-old and a 13-year-old, and at least once a year they come home with strep. So we would take them to the doctor's office, and the doctor would say, all right, we're going to send out the culture and we're going to do the rapid strep test, right? And the rapid strep test would come back negative, and the doctor would prescribe antibiotics. And I would look at the doctor and say, I guess they're just being safe. I don't know, maybe they're waiting. And I'm not really sure. I'm not a doctor. It turns out that there's something called a center score. A center score is a 5-point scale, and if you get a 4 or a 5 out of 5 on that scale, there's a high likelihood of strep. And in fact, the data shows that it's better to prescribe than not to prescribe, even if you have a negative rapid strep test. So we're able to employ things like that. There's a University of Michigan study for urinary tract infections that says if you have all these conditions and all these symptoms, it's better to treat ahead of getting the culture back. So we're able to dig up all that data and put it to use. And then last year we did over 80,000 chart reviews. With the number of visits we do, we're able to do normative analysis on our physicians' prescribing patterns, right? To make sure that we don't have outliers who are over-prescribing antibiotics or who are prescribing over-the-counter meds unnecessarily and burning up the consumer's insurance dollars.
So are you focused in any clinical area particularly, or not focused in any particular area? Are you covering the gamut?
Well, we don't do sutures over the phone.
Fair enough.
No setting of a broken bone over a video conference. We started in general medicine, both adult and pediatric, and our typical visits are still upper respiratory issues, flu symptoms. We're right in the middle now of flu season. We've just started to see the uptick, actually, the last couple of weeks.
Yeah, flu. It's good for business. Awesome.
It's a little bit, I do have a head of marketing who sometimes talks about going around and spreading flu dust everywhere. So we started there. We've really, over the course of the last year, branched out from there. And so telebehavioral health is our next big focus. We launched that at the beginning of last year, and it's growing incredibly well, both on a B2B basis as well as on a direct-to-consumer basis. We launched teledermatology last year. We have a tobacco cessation program. And we have a sexual health program. So we look at things that are underserved, appropriate for the remote delivery of care, and areas where we think we can make a real impact on cost and quality.
So let's talk about cost for a minute. So some would suggest, especially your head of marketing that's sprinkling flu dust around, that telehealth is a way to increase costs. It just makes it easier for people to access the doctor that they might not have otherwise done. And others would argue the whole point of it is to avoid cost, to avoid expensive visits, and it really all depends on who's getting paid, right? So what is the ROI you're delivering to clients, and how does it differ by client?
Sure. We're very fortunate to have as much data as we have, right? So we just announced yesterday that we've done our 2 millionth visit in the history of the company. So took us, just for context, it took us 12 years to get to the first million and 14 months to get to the second million.
Wow.
So, you talk about an inflection point.
Should have started eating those Wheaties sooner, dude.
I was, as most entrepreneurs, I was blessed and cursed with being too early. With all that data, we've been able to do some really advanced analytics. So we worked with an unbelievable physician researcher out of Harvard to look at patient data for over 1.8 million members. And it turns out that the savings from avoided unnecessary in-person care, either at the emergency room, in office, unnecessary lab testing, prescribing brand name rather than generics, et cetera, comes to almost $500 per Teladoc visit. So that provides an ROI. If we look across our
What does a Teladoc visit charge?
So we charge on a per employee per month basis, a very small amount, less than $1 usually per employee per month, and then it's about a $45 visit. So we're saving almost $500 for each one of those $45 visits, and the ROI on average across our whole book of business is about 5 to 1.
How do you convince the client that that is real and not ephemeral? Because that is tough. I mean, a lot of circumstances going on to change incentives, to change the way things are getting paid, to change bundled payments. How do you not get lost in the noise? How do you pinpoint that the savings are really from what you do?
Yeah, so there's this very, very complex methodology which essentially takes people who use Teladoc, matches them to people who are identical in profile who didn't use Teladoc but used the healthcare system for the same reason. And when I say identical, we're talking about 16 different data elements to make sure that they look alike, and we compare the overall cost.
Okay.
We've also done pre-post analysis where Teladoc's introduced in the middle of a plan year, right? So it's not at the beginning when all the other things are going in, all the other benefit changes are going in, and we watch the cost curve change, and more importantly, the utilization curve. So how many ER visits per 1,000, how many office visits per 1,000, how many specialist visits, how many hospitalizations? Because if you end up in the ER for a headache, there's a pretty reasonable chance that you're going to get a lot of unnecessary testing. There's also a reasonable chance that you're going to be admitted or at least held for observation, which probably isn't necessary.
Okay. So I'm curious about the users, if there's any sort of interesting profile. So I have a 20-year-old kid, right? So your classic cell phone user. I haven't seen her actual face in 5 years. And when I said to her she needed some service, she's away at college and she couldn't get into the college, health center. I said, hey, I got an idea. I know all these people. Why don't we use a telehealth kind of service? And she said, nobody's ever going to do that. And I said, obviously you don't know what I do for a living. So it was so interesting to me because I would have thought of all people, she'd be the obvious person who would say, yeah, okay,
Yeah, so it's funny, I was just at a holiday party, and as you want to do, you're sort of talking about, hey, what do you do, meeting somebody new. I said, well, I run this company, we connect patients and doctors, and they said, oh, you mean like Teladoc? And I said, oh my God, yeah, because Because when I started at
It's like hearing your song on the radio.
it's crazy, right? Because when I started this, I would say telehealth, and people would say tele what, right? And they would say, you can't do that, right? Nobody's going to do that. Well, it turns out that people are doing that. But the question is a good one. Who's doing it? So contrary to popular belief, it's not necessarily the people like your daughter.
Obviously.
It's people like you and me. So about 15% of our visits are pediatric visits. If you take out the pediatric visits, who are being decided obviously by the parents, the adult medicine visit, the average age is 43. Right?
At the Styx concert last night, the average age was 65.
Well, so it turns out that we have products for them too. So in fact, we're rolling out products aimed at the sandwich generation who are taking care of their kids and taking care of their aging parents. We just announced a partnership with AARP where it gives the adult caregiver the opportunity to have a three-way interaction with their parent and a physician, and takes care of all the HIPAA controls and permissions and everything else, and makes it easy for the aging parent to be involved in the conversation, and for the adult caregiver to help their parent without having to travel to get there, to take off work in order to get there, et cetera. There are 40 million caregivers across the country. So, it's not what people would think about being the young invincibles or the millennials who are the only ones who are using this.
Right, okay, interesting. So is it more female or male?
Absolutely. As usual, my wife always tells me that women are smarter, and this is just another example. So 63% of our users are female. Now, we always talk about the mom being the chief family medical officer. And so a lot of our consumer engagement is targeted to get to the female head of household, which may or may not be the primary subscriber, may not be the employee on our rolls. So we're doing a tremendous amount of work to identify, to do geolocating on consumers' homes who have our benefit, and drop ads onto the cell phones in their homes.
That's creepy, dude.
It's it can be creepy. I had an analyst, so now, as a newly public company, I spend an awful lot of time with research analysts. And so I was talking to an analyst recently, and he said, you guys must be spending a ton of money on advertising. Every time I'm on Facebook, I see ads for Teladoc. And I say, well, you've seen our financials. You know that we're not spending a ridiculous amount on advertising. It just so happens your firm is a client of ours, and somewhere in your Facebook feed you identified that your employee, who you work for, right? So I'm able to target you on Facebook. Now, you don't know that. It's not creepy because I'm not saying, hey, I know that you're an employee of Piper Jaffray, and so I'm all over you. But rather, I'm here doing a lot of marketing, right? And so it looks like we're just a massive marketer to that person. And so we really focus on what we call surround sound.
Yep.
Where we're doing direct mail to you, we're doing email campaigns to you, we're in your Facebook feed, we're on your mobile phone, we're doing IP targeting if we know where you work.
So you're a stalker, basically.
Yeah, we're sort of an internet stalker.
Okay, got it. So let me ask you, you've been there, what, 6 years? 5?
7.5.
7.5 years, okay.
Yeah. Can't you tell by the gray hair?
Yeah, no, I buy new colors for mine. So, what's the biggest mistake you made, and how did you recover from that?
This will be near and dear to your heart. I would say every time we raise money, I should have raised more. Right, so I raised capital, of the 7 years, I think I've raised capital all but one.
Wow.
That's a tremendous time suck.
Why did you choose to do it that way?
Well, some of it's sensitivity of the existing investors, right, who never want to be diluted more than. Are
you going to blame that on the investors, not on management? Huh? Interesting. Okay. I'm not going to go there, but okay.
I don't think I ever said no. I want to take less money from you, but I should have pushed harder to raise more money each round that we did.
Okay.
The only one I would say was an exception was when we finally took the company public. I think we raised the right amount of capital then. $180 million offering was probably the right amount there. But you know, I would say that was probably the biggest mistake. You know, the other mistakes are, I think I thought things would move even faster than they did. You know, 7 years in, that's kind of a long time. But I think everybody always says the same thing with respect to people. It's all about the people. And when you have somebody who's not working out, you should probably move faster rather than slower.
Okay. So what's your mantra as an entrepreneur? Sort of what's the thing you tell yourself every day to keep going, or what you can put it in the form of advice to entrepreneurs?
You know, it's funny, listening to Sean and then the introduction, I feel weird being here as the company that's, quote, made it, because I still
Don't worry, the economy can come crashing down. You could still go back to the old days.
That's exactly right. You know, it's all, as you say, ephemeral, right? You know, for me, I wake up every day saying there's still so much to do. I got into healthcare in the beginning. I had a family business that I was supposed to be fourth generation in, and somewhere in the middle of college, I said, you know, that's not particularly interesting to me. I want to do something that really makes a big difference. And so I got into healthcare from the beginning to make a difference. And I feel like we're really doing that. I used to run health plans, and I used to get an awful lot of hate mail, right? I was the health plan executive who used to get the hate mail from consumers saying, why won't you pay my claim? You guys are crooks. What's wrong with you? And now I get fan mail from our consumers who use our service and say, this is how healthcare should be. You know, we have net promoter scores like Apple. It's unheard of in healthcare to have mid-70s net promoter scores. But I still feel like we have so much still to do. And
what's your one good thing, the one thing you really want to see yourself do, in any form, whether it's concrete or more loose? What's your big objective going forward?
I think every American should have Teladoc. I mean, you know, I think every American should have Teladoc on their smartphone. And rather than saying, I'm sick, I need to go to the doctor, they should be saying, I'm sick, what's the best way for me to get
So your goal is world domination?
Absolutely.
All right. We'll leave it at that then. Thank you so much.
Thanks.